You're watching EAC News. Thanks for joining us. The Secretary-General of Disability Action Council and the Secretary-General of the National Council for the Social Protection held a meeting on Tuesday morning with the aim of establishing joint cooperation between the two institutions to help persons with disabilities in Cambodia. EAC News reporter Deccan Nin has more details.
The meeting was held at the Ministry of Economy and Finance, chaired by the Secretary of State of the Ministry of Social Affairs and Secretary-General of the Disability Action Council, Amchan Makara, with Under-Secretary of State of the Ministry of Economy and Secretary-General of the National Council for Social Protection, John Nadet, along with the UN Development Program Officers and Access Project Officer. The two councils discussed a number of possible collaborations, such as the draft terms of reference with input from the National Council for Social Protection on a draft selection of the international technical advisors assisting in the development of guidelines signed by both councils, particularly guidelines on disability inclusive social protection. The two sides also discussed allowing the technical working groups of the two institutions to continue reviewing and working with development partners such as UNDP and Access, and to also determine the composition of leaders and relevant officials to provide training on the guidelines of building disability-inclusive environments and social protection, and to identify mechanisms for implementing these guidelines. Guidelines for disability-inclusive social protection are necessary for the Disability Action Council, Capital and Provincial Disability Action Council, National Social Protection Council, Department of Disability Welfare, Department of Social Welfare, Ministry of Social Affairs, Disability Representative Organization, and relevant institutions to be able to identify disability-inclusive social protection or social assistance that is being or will be established by the laws, policies, and guidelines of the Royal Government of Cambodia. This is to ensure that disability inclusion is integrated into social protection policies, making policymakers better aware of inclusive practices in social protection policies, with principles that practitioners can also apply to ensure that persons with disabilities can actually benefit from the policies being implemented. In addition, it will enable persons with disabilities to fully participate in the drafting of laws and regulations and benefit from those policies and regulations put in place. According to the CSES 2019 to 2020 report, 1 in 5 households, about 18% of total households in Cambodia, spend more than 10% of their total expenditure on healthcare, while the other 5% spend more than 25% of their earnings on healthcare. Persons with disabilities are likely to pay more for healthcare, as nearly 2/3 of adults are less likely to be employed. Most persons with disabilities and their families live in low-income and insecure conditions. 35% of persons with disabilities have been living on less than 10,100 real or $2.5 a day in 2019, while 78% live on less than 18,000 real or $4.55. The poverty rate among persons without disabilities is 17.5%, and among persons with disabilities is 21.1%. Therefore, guidelines for disability-inclusive social protection are increasingly needed to help persons with disabilities to be more protected and more involved in society, to be able to address the poverty and health issues that they are facing. Deccan Nin, EAC News.